The cafe's sitting in stasis. There isn't really much we can do until it's time to open up again.
Will Priestley would usually serve hundreds of customers a day at his Hobart cafe over summer. But as the city experiences its first major COVID wave, he's made the costly decision to close.
Right off the top of my head, at least $6,000 or $7,000 this week. I'd say it's probably more, to be honest.
While 2 of his employees have been exposed to positive cases, they aren't considered official close contacts under the new national definition, which generally only includes people who've spent 4 hours in the same house as a confirmed case.
We really feel like we have a social responsibility being across from the hospital. We only have one major hospital in Hobart, so that being our major customer base, that would be an absolute disaster to pass that on to the staff.
Will is also worried about his own health after suffering a cardiac arrest a few years ago.
Once you start dividing the population number of Tasmania by the amount of cases, all of a sudden you're bound to see a couple of days. It certainly induces a lot of anxiety.
As the Omicron variant spreads, individual businesses have been left to make their own decisions about staff who've been exposed to COVID but have no symptoms.
It has been extraordinary. Just on a day-to-day basis, getting, 4 or 5 text messages from different staff members saying they're unable to work. And that's caused a huge dent in our workforce, up to 20 to 30% since Christmas. I haven't had enough staff to even serve the customers on the floor properly, let alone answer the increase of hundreds and hundreds of phone calls a day that we're getting as well.
At Catherine Bronga's pharmacy in southwest Sydney, demand for rapid antigen tests and COVID boosters is soaring. But like many, she doesn't have the staff to keep up. Some workers have been left waiting up to a week for pathology COVID test results before they can return to work.
We were seeing pharmacists who weren't getting their results for 7 days afterwards, right? And that's after their isolation period. So how do you then ensure that the pharmacist can get back and work?
For now, she's had to cancel the scheduled leave of staff who were desperate for a break.
We've actually had to bring back so many of our staff from annual leave. I myself was up at the coast, finally getting a bit of family time with my husband, who's also a doctor, and I've had to come back on several occasions from Christmas till now, just to help out.
Catherine stocked up on rapid antigen tests for her staff, but she doesn't have any tests available to sell. Doesn't know any pharmacy that does.
Australia is behind in the use of rapid antigen tests. This is a real business continuity issue for many of these businesses, particularly in heavily affected sectors. And rapid antigen tests are one of the ways that they're able to keep the lights on at the moment.
Economist Andrew Charlton advised Labor Prime Minister Kevin Rudd during the global financial crisis. He's hopeful that life with COVID will soon become less stressful.
Omicron is affecting the Australian economy, but it's likely to be a speed bump, not a roadblock to our economic recovery. And it will probably do quite a lot less damage than Delta did.
Some economic trends indicate businesses may not be suffering as much as they did during previous outbreaks. After bouncing back from Delta lockdowns, restaurant bookings have come down from huge peaks during December, but are still up on 2019 levels, while mobility data follows a similar pattern, with trips by car, public transport and pedestrian traffic falling over recent days.
I don't believe that Omicron will derail Australia's strong economic recovery. Australia's experiencing a jobs boom right now, with nearly 500,000 jobs having been created since September.
We are out of lockdown, but our businesses are not out of struggle town.
Stefanie Milla runs a chain of skincare businesses in and around Melbourne. She's on the brink of closing one of the stores though, where staff have tested positive or been close contacts.
But any one given time, with 100 staff, you would have multiple staff obviously being close contacts. So in that situation, it's quite difficult to manage. You need to actually get either a PCR test if you're a close contact, or you need to have a rapid antigen test. And what that means is you actually need to find these, and they're not readily available, right?
At another store, Steph scrambled after 3 employees caught COVID or were contacts over the New Year's break, including one who hasn't been able to return to work.
We have one of our nurses, cosmetic nurses, away for the whole week. And so that's 1 week full client roster that needs to be rescheduled.
How much lost revenue are we talking about there?
Look, I mean, probably about $15,000 for the week, because it's probably the most challenging time that we've ever had in our lives. And yeah, a couple of times you think, is this worth it? But it is, because we love what we do.
For Steph and other business owners, finding fill-in staff as cases and contacts rise may not be easy. Unemployment is relatively low and skilled migration remains at a trickle. Similar issues are impacting industries such as childcare, as cases, contacts and a workforce shortage combine to close hundreds of centres nationwide.
We already had a worker shortage in Australia before Omicron hit. Our vacancies were up 50% on pre-pandemic levels. It's as tight as we've ever seen it in Australia. Australians are more likely right now to be in a job than they have ever been since records began.
Australia's experiencing a jobs boom. We've seen nearly 500,000 new jobs created since September as our 2 largest states, New South Wales and Victoria, come out of lockdown.
Cafe owner Will Priestley has no idea when he'll reopen, but wants COVID testing delays to improve and at-risk staff to get their booster shots before then.
I couldn't bear to see someone suffer for the sake of the business. You know, money is nice, but it's certainly not everything. And I definitely want to see my staff's safety and well-being over whatever the cost. I'm not someone who will put people in harm's way for a quick buck.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.